BMI, or your body mass index, is a measure of your height and your weight with a little bit of math behind it. And it was originally done back in the 1940s by the American government when they were trying to figure out how many calories were needed to send an army to World War II. So a lot of people come to me and they say, well, I have a disease of obesity because my BMI is over 30. It's 35, 40, what have you. Or I'm healthy because my BMI is less than 30. The truth of the matter is that the BMI chart has quite a few issues with it. For most people in that age, 18 to 24 years old, 6 feet tall, they needed about 2,000 calories a day. Unfortunately, if you're not 18 to 24, male, or 6 feet tall, your calorie needs are going to drastically differ. Your BMI does correlate with the disease of obesity, but recently the CDC and the World Health Organization has redefined what is the disease for obesity. It's no longer just a BMI higher than 30, because depending on your race, your ethnicity, and your age, you may have the disease of obesity at a lower BMI than 30. The new definition for the disease of obesity is excess body fat that presents a risk to your health. So BMI itself is not necessarily the best marker for health. And a lot of what we do when we come to work with our patients is help to better understand the amount of calories needed to help maintain not only your current body weight, but what would be appropriate for you to maintain a healthy body weight. And what we talk about with that is something called your BMR, which is your basal metabolic rate, or in other words, how many calories a day does it take for your body to sustain your current weight. Now, many people then say, well then what is the most accurate physical measure of health? And for many people, it's a measure that you've never heard of. Its acronym is VAT, or VAT. It stands for visceral adipose tissue. It means the amount of fat that is around your internal organs. See, when you gain excess body weight, it doesn't just go underneath your skin. It's in your neck, it's around your heart, it's around your lungs, it's deep inside of your abdomen as well. And when you have that fat that's around your liver, or it's around your pancreas, it's around your kidneys, that fat invades those tissues, increases inflammation, and puts you at lots of risk for having bad outcomes. In fact, for people who gain weight kind of everywhere in their body, they tend to do better long-term than people who gain their weight just in their abdomen. So when you are looking at what is the best measure for your overall health, it really is your waist circumference. And waist circumference is not down at your hips, it's where you would measure 2 inches up from where your belly button is, or should be, depending on your overall health. And you would measure around that and get an idea of what your health is.